April is National Minority Health Month, an observance dedicated to raising awareness about health disparities affecting racial and ethnic minority populations. The 2025 theme, Advancing Commitments to Eliminate Health Disparities, underscores the ongoing efforts required to address these inequities. Hey everybody, it's your girl Janine Latrice Perez. How you living? I hope that you are living your absolute best life. Listen, this is the place where we're purposed, intentional, and unapologetic about prevention, conversation, advocacy, and youth engagement. So, are you ready? How you living? Boy, 'cause I'm living my best life. And I ain't gonna hold back. 'Cause I'm living my best life. And I ain't got time to be fooling with you. They say closed mouths won't get fed. Like a closed heart can't be read. Can't live the same way as before. Just cut the ties and shut the door. Held out way too long. Should've spoke up, should've been gone. Stop singing that same old song. No, 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 no. 'Cause you don't wanna cry, so I'm gonna say. Hey everybody, it's your girl Janine Latrice Perez. How you living? I hope that you living your best life. Listen, we're here once again. I hope you enjoyed the episodes from January and February, and don't forget December. Although we posted them a little bit after that, you should really get a kick out of viewing each and every last one of them. I had a really good time with Sandra Ledbetter and Shelly Speaks. Okay, I should say Shelly Speaks, but really it's Ruby Michelle Stewart Brown, aka Shelly Speaks, last month. Teen Mental Health and then Heart Health Month. Absolutely wonderful. But this month, the month of April, we're talking about minority health. National Minority Health Month it is. So April is National Minority Health Month. This observance is dedicated to raising awareness about health disparities affecting folks that look like me and ethnic minority populations. So our 2025 theme, Advancing Commitments to Eliminate Health Disparities, underscores the ongoing efforts required to address these inequities. So I'm going to talk about a few things. By no means am I an expert, except that I'm a minority and it affects my health, right? But I do want to talk about some of the things that I pulled, and I'll make sure that I provide the link at the end of this episode so that you can go back and check for yourself. So let's talk about some Arkansas specific health disparities, like maternal mortality. Arkansas, did you know this? That Arkansas has one of the highest maternal mortality rates in the United States, with black women facing a risk twice that of white women. You know, I wouldn't have thought that that was a thing, but I know people that have been impacted by this. I've watched various news clippings about how this comes about, and you know, and I really want to just be gangster with what I'm talking about, but I don't even know what his role, but Canada. Okay, I know I grit my teeth and it's okay, but he's even quoted as having said something that, you know, when it comes to vaccinations, right, that black people, okay, ooh, and I probably will misquote him, but it ain't hard to do. You know, they don't really need the same vaccines because they're stronger than some crazy. If I had my phone, I'd look that crazy mess up, but that's the perception, something just like that. And I may not need to be political at all, but you know what, here we speak the truth. We're purposed, intentional, and unapologetic about the conversation about prevention. And if there are falsehoods out there that black people, black and brown, black, brown, and red people have a different DNA setup, and so
they don't need to be protected in a certain way, or their pain tolerance is higher and so they don't need what others need, then that misconception is going to cause such, oh, well, you just had a baby, okay, you're fine because your pain tolerance is higher. I mean, I've heard those myths, and it's such a sad thing. But yes, Arkansas has one of the highest maternal mortality rates in the United States, and black women, as I already said, face a risk twice that of white counterparts. All right, now infant mortality. The state also reports elevated infant mortality rates, disproportionately affecting minority communities. I mean, that needs to have a whole conversation. And again, I'm not an expert by any means. I'm just stating the facts, and I'll give you the links where you can find out that information for yourself. So let's talk about stroke incidents. Arkansas is part of the stroke belt. Who knew? Stroke belt. You know, Sandra Ledbetter talked about her heart and her heart attack. So Stroke Month, a region identified for its high stroke mortality rates. Counties like Phillips County, with a 62% African American population, have life expectancies as low as 68.98 years. That's crazy. Now you can look this up too. I'm going to find that on Wikipedia. Medical education diversity. Enrollment of first-year black medical students in Arkansas has declined sharply. And given this political climate that we live in right now, I'm wondering, with the whole DEI, and which that's crazy, because it's, you know, the myth again is that black students are getting preferences over white students, or black, brown, and red students are getting preferences over white students. But really, we're at the lowest at the totem pole when it comes to diversity, equity, and inclusion. Again, those facts are out there. So with this, it says from 9.8% to 3.5% within a year. It raises concerns for future representation in healthcare. And now, this was before the climate that we live in now. So I can only imagine. So where's the diversity, equity, inclusion in that piece? All right, so let's go on. So there are some recent initiatives. Healthy Moms, Healthy Babies Act. Governor Sarah Huckabee Sanders introduced this legislative initiative to improve maternal health concerns, so that's good. The act proposes Medicaid reforms, including coverage for doula services and increased reimbursements for deliveries, allocating approximately $45 million annually to these efforts. So again, just by virtue of this, I don't know what April's going to look like. We actually film ahead of time, so I'm not sure what April's going to look like. But given the climate and the fact that our current leadership has basically said that we're going to do away with Medicaid, I'm not sure how this may impact what Governor Sarah Huckabee has allocated for our state. So we shall soon see. Okay. That's, again, I will provide those notes. This is a really short episode, but we just wanted to make sure that you are aware that April is National Minority Health Month, and some of the things that are going on. Thank you, Sarah Huckabee, Governor Sarah Huckabee, for what you're doing to help maternal health, and how that's going to help minority maternal health as well. Now, how to participate in some of the activities for National Minority Health Month. Go to social media and use the hashtag Advancing Commitments to share your organization's efforts to reducing health disparities. Stay informed. Subscribe to newsletters from the Office of Minority Health. Again, I just don't know. I just don't know how relevant come April this will be, but I'm still going to put it out there. So subscribe to newsletters from OMH for updates on observances and opportunities to contribute to health equity, and utilize resources. Visit the OMH website for information and tools to support culturally and linguistically appropriate services. You know, this observance has been going on for quite some time, and to know that quite a few of the opportunities to help the community are being stripped away. I'm not even sure how this is going to go over, but I'm still going to speak to it. So National Minority Health Month serves as a pivotal time to reflect on and address the systematic health disparities that persist in Arkansas and across the nation. By acknowledging these challenges and activities and actively participating in initiatives aimed at equity, we can work towards a healthier future for all. Okay, yeah. It's National Minority Health Month. This is April. The theme is advancing commitments. Let's see if those commitments are going to actually be advanced. And even if not on a federal level, we're thankful for those initiatives on the state level, and you can do this on a local level, right there in your communities, helping those that are impacted. I'm your girl, Janine Latrice Perez. This is How You Living. We're gonna need to bond together so that we can live our best lives. Thank you. Hey everybody. Okay, so I ended the episode, but I'm coming back because as I'm talking to videographer Keep Pushing Productions, I talk about the relevance of how I spoke to it, the climate of how agencies are being dismantled. So let me speak from a perspective, from a minority perspective, and from someone who I'm an advocate for my health. We talked about that in the last episodes, about being an advocate for your health. For anyone watching this that may have some challenges, or if you don't have challenges now, you may know someone is challenged, or a common cold nowadays, a common cold can lead to respiratory infections, which can lead to ultimately, some time in the hospital. Because I don't want to be bleak and, but death, simple things. Listen, from a grassroots effort, I get on here and I tell you my whole name, Janine Latrice Perez. I ask you how you're living, and then I say, I really want you to live your absolute best life. And in order to do that, in whatever climate we're in, we have to be boots on the ground, grassroots effort. That's what prevention is all about. Advocating for ourselves and advocating for others so that we can live our best lives. People, listen. Be an advocate for yourself. Don't take a common cold for granted. Don't take a lump for granted, a bump, a certain kind of pain or a rash. Don't take anything for granted, and make sure that you get what you need. And if your answers, your questions are not being answered the way you need them to be, don't let go. Make sure you get what you need. I got teary-eyed off camera, so I'm not going to do that here. But grassroots, boots on the ground, spread the information that needs to be spread. Prevention saves lives. Get your yearly checkups. Dental hygiene. And this goes for everyone. Although we're observing here in April National Minority Health Month, this is for everyone. Eat right, okay? Eat your fruits and vegetables. Get the right amount of protein. Get some sun. Get some exercise, okay? Now I'm getting emotional. Take care of you. Because I truly want you to live your best life. And in order to do that, you have got to be an advocate for yourself, for your family, for your friends. Okay, I guess I'll end it now. I'm out. I'm Janine Latrice Perez. This is How You Living, where we're purposed, intentional, unapologetic about prevention, the conversation, advocacy, and youth engagement.